One of the magical things about treating ITP or focusing on ITP is every one of you guys out there are so unique and different that it would be almost an insult to expect that there'd be one diet that would fix you all, because there are different needs that you have and there are different priorities and different problems. And so the approach to life should be very different as well.
Welcome to Beyond the Count. I'm founder and CEO of ITP Australia and New Zealand and your host, Danielle Boyle. This is a space created for the ITP community by the ITP community, where we share real stories, expert insights, and everything in between. Whether you're living with immune thrombocytopenia, supporting someone who is, or just curious about what life looks like beyond the bruises and the blood tests, you're in the right place. So whether you're driving, out for a walk, folding the laundry, or just sitting back and tuning in, let's dive in and go beyond the count. In this episode of Beyond the Count, I'm joined once again by Associate Professor Dr. Phil Choi, ITP specialist and haematologist. In the final part of our Fueling Your Health series, we focus on managing the symptoms of ITP and the side effects of common treatments like steroids, IVIG and TPOs. Dr. Choi shares practical insights on fatigue, iron deficiency, food interactions with medications, and how simple dietary choices might help you feel more in control, even when ITP feels anything but predictable. Let's get into it. Now, we've made it all the way through 3 parts. We're finally at our 4th part, Phil. You excited?
Oh, I am, but I'm also sad that it's about to finish.
But it doesn't mean that we won't have you on for another topic. So don't be worried about that. Don't be worried about that. I can always find something for us to get together and to talk about. So in this part of the Fueling Your Health podcast, we'll be talking about managing symptoms of ITP and side effects of treatments. And there's a massive depth of information that we can definitely talk about and discuss. So maybe we start off by talking about some of the biggest challenges with ITP itself and talk about some of the symptoms that that are reported by patients.
Sure, absolutely. So one of the big problems with ITP is fatigue, and there's probably a whole range of different causes for different people. And so it's going to be really important, if fatigue is a big problem for you, to make sure you have a lot of time to have careful conversations with your doctor, and make sure that a thorough search has been concluded to tick off a whole range of other diseases that happen commonly in people with ITP and that can all cause fatigue. So things like thyroid disease can cause fatigue. Iron deficiency, which is really common, we'll talk about soon, can cause fatigue. Fatigue is a really common side effect of depression and poor sleep, insomnia, poor sleep quality as well as quantity, and anxiety disorders that leave you up all night will also lead to fatigue. Just the lethargy that comes with being in a hospital can lead to reduced levels of fitness. And in an aerobic way, that can also lead to fatigue too. So, as doctors, we're pretty guilty of using a lot of treatments that are going to cause fatigue, and steroids, which we'll talk about soon, that, if anyone's got ITP that's needed treatment, pretty much all of you have had the taste of steroids, and that's going to cause fatigue in so many ways, like muscle weakness, as well as the poor sleep quality and poor sleep quantity we mentioned earlier. But, interestingly enough, there is this little neurotransmitter hormone thing in our bodies that we all have called serotonin. Serotonin is such an important little messenger that our brain and our nerves use, that it's long been known that when we don't have enough serotonin at the right places, it leads to depression. And that's why one of the most common types of antidepressant medications and anti-anxiety medications are a whole class of drugs called selective serotonin reuptake inhibitors. And the whole point of these medications is they help increase the amount of serotonin that's available in those nerves and those neuronal junctions where nerves talk to each other. Fast forward to ITP, did you know that 90% of the body's serotonin is actually circulating in your platelets? Which means that if you've suddenly destroyed all of your platelets because your immune system's hacking away at them and you've got this disease called ITP, it does lead us to wonder what's happened to the serotonin in your body. Have you destroyed it as well? Have you lost it? Is that part of the reason why some of you feel so low in your mood, so poor in your sleep and your digestion? Serotonin happens to be, I guess, a compound that your body actually makes using a building block called tryptophan. And tryptophan's naturally in a lot of foods, but you can get supplements of tryptophan so that your body can then turn the tryptophan into serotonin. But foods that naturally have lots of tryptophan are things like eggs and cheese and meats like turkey and salmon. And again, those nuts and seeds, all sorts of carbohydrates have lots of tryptophan. So you might want to just increase or feel good about eating those things in your diet, or you might try some tryptophan supplements that may help your body try to replenish the serotonin that maybe has been destroyed as your platelets have been with the ITP that you've got. Who knows? We don't really know if this is necessarily going to work. There isn't a lot of science behind it. As doctors, we're pretty terrible at measuring fatigue. And to be honest, though, even as a person, like it's very hard for us to track how fatigued we are on a Monday compared to a Tuesday. Like, how do you put a score on how you feel? And even if you did, there's so many different things that can contribute to how you feel on any given day, like how you slept at night, which side of the bed you rolled out of in the morning, how your colleagues are treating you at work, how much traffic there was on the way into work. You know, there's lots of things that can affect how you feel. And so I can understand why it'd be hard to measure.
I understand that too. Talking about serotonin. Now, guys, if you go back to part 1 of this series, we actually dig into this a little bit more as well. But when it comes to fatigue, personally, I get a lot of brain fog, so it actually presents a little bit differently every time. And for me, is it because of my ITP? Is it because I'm working too hard? Is it because I haven't exercised enough? My iron levels or my vitamin D levels in winter even a lot lower. There's all of these different things that you need to, I suppose, investigate and really look into.
Yeah, definitely, because, serotonin might be an issue for some people, but if your iron levels are really low, then that's quite well known to also cause fatigue. And to be honest, of all things, ITP patients really are at a higher risk of iron deficiency for lots of reasons. So, for example, if you're female with ITP and you're menstruating, you might find that your menstruation is a lot heavier, particularly when your platelet counts are lower. You might be bleeding from other places, whether it's the bowel or from your nose. And again, you might decide to restrict your diet in certain ways as part of, say, an autoimmune protocol or as part of an anti-inflammatory diet. And then in the end, some of the choices you make might end up leading to having a low iron level. So a lot of the time, having iron with vitamin C can be really effective in supplements because that helps absorb iron when you have lots of vitamin C. But a lot of those supplements in tablet forms also cause a lot of constipation. Beware, there are in health food stores tablets that are marketed as iron tablets for maintaining iron balance, and they say that they don't cause any constipation, but that's more because they've got tiny amounts of iron in them, and they're not necessarily going to be great if you want to build up your iron levels when they're low. That might be helpful for people whose iron levels are already normal, but then you could ask yourself, do I really need them? These days, though, getting the occasional injection of iron is a lot safer in 2025 than it was 30 years ago or 40 years ago, because a lot of the intravenous iron preparations are a lot more consistent and a lot less likely to cause allergic reactions as well as other side effects. And to be honest, though, using an intravenous iron infusion is, at the more severe end of the scale. It's a bit more of a sledgehammer, but it's sometimes needed in ITP patients who've had a lot of bleeding and a lot of iron deficiency and get a lot of constipation with iron tablets. Let's just get in there and fix the iron problem and try to get their life back on track. And so we'll do it. And we tend to, these days, prefer a product called ferric maltose that has a lot less of an impact on your calcium levels and your phosphate levels. And it causes less loss of bone density. That seems to be the sort of the current flavor of the month.
So one of the hot tips when it comes to iron infusions, personally, I do have iron infusions quite regularly, every 18 months or every 2 years, and I see it as an investment in my health. I sort of do it through my GP, and I actually have a countdown of when I'm having it because I get very excited. But talking to a couple of the healthcare professionals who provide iron infusions regularly in the ITP centres in the UK to help ward off some of the side effects post the iron infusion, they say to increase your potassium. So have a banana in the days leading up to your iron infusion, and that will help reduce some of the side effects of the actual iron infusion as well. I know I start to bounce off walls about day 4 or day 5. And I'm
more than usual.
Yeah, I know, right? I'm normally quite an active person, and can you imagine me at top speed? I don't think anyone would ever like to see me at top speed, especially not for a very long time. But it's normally about a 24-hour window, and I'm like the Energizer Bunny. It's just, a lot of fun, but it's good. I always pack up quite a bit of work that needs to be done, and I can just speed and motor through it.
Yeah, definitely. I mean, I have a low threshold these days to offer iron infusions because I feel as though we can deliver them pretty safely, and life can be short for some people. Like, why bash through for a long time when we can try to just fix the problem quickly, particularly in chronic diseases where you've already been beating your head against a brick wall for 18 months or so.
Thanks to our sponsor Sobi for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
Shall we move on to steroids?
Yeah, absolutely. So like I mentioned before, anyone who's had ITP that's needed treatment, their doctor's been tempted to write the script for steroids. But steroids are always going to cause so many side effects that it's really almost as nasty as the disease itself. But some of the most common side effects from steroids, we could maybe try to affect the severity of them by some of the dietary choices that we make. So, for example, coming back to that poor sleep quality and insomnia and staying up at night, if sleep is a problem and you're 2 weeks into a high-dose course of prednisone, probably avoid that enjoyable caffeine that you've been drinking, and maybe try some melatonin that we sort of talked about in one of the earlier podcasts. If you're getting a lot of dyspepsia or a lot of acid reflux up the back of the throat, again, that's a good reason to avoid caffeine that we know loosens the esophageal sphincter. Spicy foods and oily foods, again, put a lot of stress, not stress, but they need your gallbladder and your liver to work really well. And if they're not, then sometimes these things splashing around in your belly are going to make you feel less comfortable. So why do that to yourself? You might have to just go down a bland diet for a few days. Weight gain, we know, is a big problem with steroids. And so the temptation's going to be to just keep eating the next slice of cake, but maybe avoid the calorie-dense foods, and maybe that's the time to chow down on celery sticks and carrot sticks and try munching on things that you know aren't going to give you all those calories. We know that when you are having lots of steroids on board, your sugar levels are going to be a fraction higher, and that can affect the balance of certain bugs, like in your mouth or even in other body parts. And so thrush is a lot more common when your sugar levels in your bloodstream are high. So again, a good reason to avoid calorie-rich, sort of high sugar foods. And we talked before about fatigue and depression and low energy levels, but definitely this is probably not the time when you're on steroids to be on a highly restricted autoimmune protocol at the same time. I'd probably counsel people to balance their diet, have it as broad and as healthy as possible with lots of different things rather than just like heaps of one thing, you know, because you just want to make sure that you're not missing out on any important minerals or vitamins. And bone density is such a huge issue, again, with our ITP patients who are on and off sometimes big doses of steroids. And again, you know, with some iron infusions that can leach the phosphate out. It's so important to stay on top of your calcium intake and vitamin D intake with vitamin D rich foods. You don't have to have tablet supplements, but if you're finding it hard to get those levels into you, or if your vitamin D levels are already low and then you get ITP, then that's a good reason to really focus on it. But steroids aren't the only first-line treatment that a lot of people will get. A lot of people have had immunoglobulins or IVIG, and some of you might remember getting headaches shortly after them or with them, and sometimes those headaches roll into migraines, and sometimes those migraines become so severe there are people who end up in hospital with the most severe form of headache called meningitis, and they just can't even keep their eyes open. They can't bear to hear loud noises. They're vomiting, and there's inflammation basically in the brain or around the brain. One of the things that we could probably do is to make sure we maintain as much hydration as possible so that the impact of the immunoglobulins isn't too bad, and we try to avoid anything that might dehydrate us. So again, try to avoid caffeines and teas and alcohol around the time that you're getting the immunoglobulins. After that, sure, go back to what you normally do. If your doctor's prescribed you any medications, sometimes there are specific things that you have to avoid. So if any of you are on L-trombopag, which is the thrombopoietin receptor agonist, you would already know that you have to avoid having that tablet with anything in the stomach for, I think, 2 or 3 hours before and 2 or 3 hours after. Anything that can have a positive cation in it. So by that we mean things like iron, calcium, magnesium, any of those minerals. Whether that be supplements or whether that be a glass of milk, whether it be a milkshake or a piece of cheese, you can't have any of that anywhere within several hours of an L-trombopag tablet. Otherwise, you won't be able to absorb it.
One of the top tips for that is actually setting an alarm 4 hours after, 3 or 4 hours after you've ingested that particular item, so you know that you've had that clear window so you can have food again. And then as soon as you've had that medication, reset that alarm for another 3-4 hours. So then that way you know that you definitively that window is safe and that window has been allocated, I suppose, is the best way of saying it.
Yeah, that's a great tip. I know a lot of other people who sometimes try to take it late at night so that it's well and truly after their dinner. Presumably they're not people who have an ice cream just before they go to bed. But the tablet's probably out of the stomach by the time they get to breakfast in the morning. So yeah, it can be a lot of work just to ensure that there's a steady amount of the chemical in your bloodstream.
And I think too is that it is right for some people. So for me, again, I keep sort of coming back to myself, but I've been on Eltrombopag now for nearly 10 years. And for me, it works. It is work. It's hard work. But I'm in such a good routine now that I set an alarm in the middle of the night and roll over and take the medication. I can actually do it now with my eyes closed, all by feel. So you get to a point where you do get used to it.
Yeah, it's like being married to the same person for 10 years, isn't it?
I would happily give up Eltrombopag. Probably not my partner though. After 10 years. Oh my goodness. So out of all of these bits and pieces, there's so many elements there that, can really impact ITP, can impact your quality of life as well when we're talking about, different treatments, the side effects, the symptoms. And these are all parts of things that become part of, that will help shape your treatment goals that you want to achieve or no treatments with your ITP. So all of these elements are really important to consider and to think about.
Yeah.
And while there's no perfect diet, unless there's one, you've got one up your sleeve, Phil, is there a perfect diet for ITP?
Yeah, I wish I had. But, I think one of the magical things about treating ITP or focusing on ITP is every one of you guys out there are so unique and different that it would be almost an insult to expect that there'd be one diet that would fix you all, because there are different needs that you have and there are different priorities and different problems. You don't all need a platelet count that's 300. You don't all need to stop bleeding if you already don't have much bleeding. And look, some of you have like the worst fatigue, but I'm sure there are others who don't experience as much fatigue at all. And so the experience is very different. And so the approach to life should be very different as well. I'm not going to say that it's necessarily a panacea, but there is one little thing that I have come across from a particular patient of mine. And I wouldn't say it's a diet as much as a friendly little drink that sometimes you could enjoy. But for now, we're just going to call it Kate's tea. I don't know where she got it from. It might be from one of the other listeners on this podcast. But it's a tea made from cinnamon, lemon juice, apple cider vinegar, honey, and hot water. You can probably look up the recipe, probably in the comments or from the article itself. But I kid you not, since Kate's been on Kate's tea, her platelets have gone from being in the 20s to being over 100. And sure, there are other things that could have caused that or had an impact on it. But if you were to know her for as long as I have and to have seen how certain treatments haven't really had that much of an impact on her ITP, it does make you wonder whether sometimes there's something magical in just a cup of tea with some simple ingredients that work for some people and maybe they don't work for other people. But what harm is it if it's a pleasant drink?
And I've actually tried this tea and it doesn't taste too bad either. So regardless of it actually helping platelets or not, I think it's a pretty good tea.
Exactly. So why? I mean, and that's the same with a lot of the dietary choices we've been talking about. No one's talking about going off and just eating, I don't know, like black seed pulp for 5 weeks straight and not seeing any sunlight and, having to avoid meat and vegetable and fruit or whatever. We're talking about when you're at the grocery store and you're already trying to choose between, foods that might have lots of vitamin A in them, like carrots and pumpkin, versus having something that might not have as much vitamin A in it. Maybe you will want to give that a go because we know that ATRA or all-trans retinoic acid can be really helpful for your bone marrow's production of platelets. And why not choose the stuff that you might enjoy that also might have health benefits? It's not about having to go without things that would enrich your life. It's just about being more informed about the choices you make and how you might be able to influence your own destiny.
Couldn't have put it better myself. Perfect. Absolutely perfect. Thank you so much again for joining us. I think everyone will definitely walk away from this 4-part podcast with something to consider. And, if anyone does listen to this and decides that they want to make a change and they see a benefit, talk to their doctor and let us know as well. We'd love to hear your anecdotal feedback and how this may have actually helped you improve your quality of life or reduce symptoms or side effects, or if it does help your platelet count and does help you reduce bleeding, well, that's also really good too. So thank you so much.
You're welcome. Look forward to any feedback and look forward to catching up with you again next time, Danielle.
The information in this episode is general in nature and not intended to replace individual medical advice. Always speak with your haematologist, GP, or healthcare team before making any changes to your treatment or diet. Every person's situation with ITP is different, and what works for one person may not be right for another. I hope you all got a lot out of today's episode. And before we wrap up, here are 3 key takeaways from our conversation with Dr. Phil Choi. Number 1, investigate fatigue from all angles. Fatigue can come from many sources and not just ITP itself. Make sure your doctor checks things like iron levels, thyroid function, and mental health. Tryptophan-rich foods like turkey, cheese, and nuts may also support serotonin, which play a key role in mood and energy. Number 2, think about food timing with medication. Some ITP treatments, like eltrombopag, need to be taken on an empty stomach away from calcium, iron, or magnesium. Set alarms or build a routine to help you stick to the right timing and get the most benefit from your medication. Number 3, when in doubt, start with simple nutritional wins. Supporting iron levels, staying hydrated before IVIG, and managing reflux or sugar intake during steroid use can help ease some of those side effects. There's not one ITP diet, but informed choices can support your quality of life. And don't forget to download your free information sheets on diet and nutrition based on Dr. Choi's article at itpanz.org.au. Search Fueling Your Health in the news section to grab yours today. A big thank you to Dr. Phil Choi for joining us today and throughout this series. This was the 4th and final part of our Fueling Your Health series. Don't forget to go back and listen to the other episodes on boosting platelet counts, reducing bleeding, and the immune system. If you're looking for support, join the ITP community at itpanz.org.au. While you're online, check out the latest edition of The Count, our quarterly magazine. Read some of the great patient stories we have in our news section. Download a huge range of treatment information, guidelines and more in our patient resources section, and know that you are not alone. We are here to support you. We are here to provide you and inform you with all of the latest information when it comes to immune thrombocytopenia. If you found this episode helpful, please share it with others in the ITP community, and don't forget to leave a review on the platform you're listening from. It helps others find Beyond the Count. We've got more expert conversations coming your way really soon, so hit the follow or subscribe button to stay updated. And thanks for tuning in and diving beyond the count with us.